Today's webinar will focus on the past, present, and future of population health and well-being and how well-being will impact your business moving forward. Presenting today is Brittany Nelson, the Director of Population Health and Well-being at Shepherd Insurance. Brittany is a registered dietitian, certified health and well-being coach, and has experience providing corporate wellness solutions for diverse populations. She works closely with the Employee Benefits Division at Shepherd Insurance to enhance clients' corporate wellness strategies. She believes population health and wellness have the greatest impact when embedded in the corporate strategy and overall culture. As a reminder, the recorded version of this webinar will be available following the completion of this session. You can look for a link to the recording and the slide deck for reference emailed to the email you registered with before the end of the work week. We'd love to hear from you, but we ask that you please hold all questions for our Q&A session toward the end of this presentation. However, the chat will be open and monitored throughout the entire webinar if you need clarification. For those of you just joining, welcome. Our presenter, Brittany Nelson, is here to speak on the past, present, and future of population health and well-being and how well-being will impact your business moving forward. Brittany, the floor is yours.
Thank you, Mary Ashley, and welcome everyone. Good morning, mid-morning. I hope everyone's doing good, and thanks for spending time with me a little bit today to discuss this wellness industry. As Mary Ashley mentioned, my name is Brittany. I'm a registered dietitian, certified health and well-being coach, and have a master's degree in wellness management. I've been kind of told I'm a little bit of a wellness disruptor, as in I don't like doing things just because we've always done them that way. And so I hope you can kind of see how the wellness industry has changed a little bit and how we're kind of supporting our clients and enhancing that. I do work in our employee benefits division primarily, but welcome to all of our PNC clients as well as our employee benefit clients, our friends and family out there. We're really looking forward to supporting you, and this just kind of being the start of some of the discussion we can really have to supporting your employees and their overall well-being. I'd also like to give a disclaimer that the information shared today is meant to be relatable. It is not meant to paint a one-sided or perfect picture to a high-level organizational well-being. I honestly believe that to be cyclical versus an achieved destination, and it's very much individualized for your culture. So really this presentation is supposed to really start the conversation with you, know the services that you have available within Shepherd Insurance, and also to increase your knowledge about what's going on in the industry. So if you can go to the next slide, thank you. So we're going to go on a little journey today, if you will. Kind of like as the title, you can understand we're going to be going to where we've been. So where's the wellness industry been? What have we seen? Where we currently are at Shepherd, as well as where the industry is, some best practices that are going on, and then where we see the well-being and population health industry going and some things to be aware of in the future. Go to the next slide. But before we get started, we're going to do a quick poll. So the poll says the wellness industry makes up $4.5 trillion, and I won't cheat, $50 million of that 4.5, 50 million is around corporate wellness. So that's the corporate wellness industry. Question, how much money does your company spend, or as I like to say, invest on corporate wellness strategies? How much money? There's some A to E options below, so you should be seeing a poll come up pretty soon where you can take that. Rules don't lie, please. This is anonymous, so it's meant to be very honest. We want to see everyone on the call's responses. And 2, don't include incentives. So there's some employers that are doing HSA incentives or premium differential. Don't include those in that investment cost. Incentives are something we're not going to really touch on today in our presentation. I could honestly do a webinar just on incentives and how they affect behavior change or diversity, equity, inclusion, standard determinants of health. So we're not going to talk too much about incentives today. That being said, if you are not providing incentives for your employees to participate in wellness activities, talk to us first, because incentives can become the employee expectation really quickly and difficult to detangle. If you are providing incentives, please talk to us and we can help enhance those programs as well. So let's look at the results here. All right, so we have a result of greater than $5,000 is being invested. And then the second, close second of I have no idea and wish I did. 68% of employers are providing some type of incentive or investment for corporate wellness. And then, so it's not, this isn't surprising to me, but what is surprising is the greater than 5,000. That's not a number that I would expect to see, but it's very interesting, as in that's a decent investment. So hopefully I'll have your attention now on if that investment is going in the right direction and if we know it's working the way we want it to. So go to the next slide. So where we've been, I've worked in the industry for a little over 10 years, and what got me interested in working in corporate wellness was actually a job that I had in between graduating from my dietetics degree to doing my dietetics internship. And I worked in a manufacturing plant on the assembly line during the summer. So it was steel toe boots, hard hat, sweat, lots of sweat, long work days. I got to talk to all the employees on my assembly line, my team, mostly men, some women. We had lunch breaks that were about 45 minutes long, and we'd have lunch right next to the assembly line. But there was one employee that I would talk to most often. His name was John. We're just gonna say his name was John. His name was John. And John had been really struggling that summer with his daughter. And I don't know if he talked to me because I was the age of his daughter, or if it was because I was going to school as a dietitian, but John's daughter was going through a lot of mental health struggles, and she had a lot of body dysmorphia. It really was affecting his overall well-being. He said, I can't control what she's doing. She doesn't live in the house anymore. So I just drink to help numb the pain. He was having a really hard time. He talked to me about his marriage and how that had struggled because he didn't know what to do. And so one day specifically, John and me were talking. We were in a deep conversation. I was trying to give him tips and whatnot. And up walked a little girl in her exercise outfit and a hard hat. She just looked like she didn't really belong as an employee, but she worked for employee health. And she came up to us. She goes, "Hi, hope you're having a great day. Would you guys be interested in participating in the Couch to 5K walking challenge?" And me, I was like, sure, I'm interested in health. I'm excited, knowing that I'm sure in hell is going to be going home and sitting on the couch after a long work day on that assembly line. But I was interested. John was not. John said, "No, I'm good, thanks." And off she went on to the next group of employees. That right there made me interested in wellness. John had been going through so much. He wanted to probably walk and take care of himself, but he was halted by the struggles he was going through. So I got into wellness. I turned my degree from nutrition to overall wellness. And I've continued over the next few years seeing how wellness programs really were not overall well-being. They were very much physical health program based. I would sit in screenings with employees like Frantic Frank, who would make me take his blood pressure 8 times just so that his blood pressure would be considered normal, and he would get his incentive and he wouldn't have to meet with the health coach. I would weigh people like Competitive Carl during his Biggest Loser challenge at the beginning of it, and he would tell me and joke with me about how he gained 5 or 10 pounds just to be that much more competitive in the Biggest Loser challenge, just to talk with weight conscious Wendy about how she was very frustrated with the challenge because she couldn't lose weight as fast or as easy as some other people. So all of this to say, the problem around where we've been with corporate wellness is we've been thinking completely mechanistic. So my guess is 15, 20 years ago, we had some leaders in the room and they said, healthcare is so costly, right? Our insurance is so costly. What can we do? They started looking at maybe some data and seeing that some of these diseases are preventative. And so the idea was we will put these preventative programs in. Maybe we have a heart disease program. Let's put a walking challenge in. Let's put a Biggest Loser challenge in to help our people lose weight. They'll participate. Oh, wait, no, they won't participate. Let's give them money to participate in hopes that they do participate. So now we have maybe more participation, and that will allow them to decrease their risk for heart disease, get off their medications, and lower our healthcare costs. And that just hasn't happened. Hasn't happened at all. It's a very simplistic way of thinking about the overall person. Like I said with the conversation I had with John, you know, this Band-Aid approach of a walking challenge was not what was needed for him to really take care of his individual well-being. So over the years, we've really siloed wellness out here by itself, and we've just stacked program after program after program, individually thinking personally what we think would be best for our employees in a simplistic way, versus thinking of giving them the space to be able to take care of their well-being. And we expected, or maybe even were promised by a vendor, of some sort of savings or ROI, and we're left with half-driven programming that we want people to participate in that maybe we're not even participating in. So our healthcare system is still broken. Mental health strategy and support is really shattered right now, and our corporate culture still is not supporting the overall person. So let's talk a little bit about the next slide, you know, where we are now and where we see this starting to kind of take a turn. We're finally thinking of the person as a whole person. So we're finally moving from physical health only, or physical well-being only, to an overall dimensional approach. So you can see on this slide, this is from an internal standpoint, Shepherd, what we focus on when we think of the overall person. So you might have seen how some companies have called it wellness. Well, now they're calling it well-being, right? And you have to be careful, because sometimes they're continuing to use this stackable approach to just around well-being programs, the overall person. So we're going to talk a little bit about how to see the difference between that. But we are seeing that well-being is not as siloed. So it's not as the company's over here, its goals are over here, and wellness is over here doing its own thing. We started bringing this in together, and the diversity, equity, inclusion, and belonging has really helped us kind of start seeing some of that, bringing breaking down that silo and kind of aligning it with the organizational goals. We've also started seeing the idea of leadership commitment. So in the past, we've had leadership support. You know, like I said, leadership maybe had saw a line item and they said, this is expensive, this will work, very mechanistic, check, yep, it's in the budget, go. Now we're seeing leadership saying, well, this hasn't worked, and so we need to be committed, right? If we aren't interested in doing it, how can we have our employees doing it? And we're aligning it with the overall strategy. And so the culture is really being assessed here. So the organizational goals, mission, vision, shared values are being brought in, and understanding how well-being, total well-being of our people are really affecting that. Employers are giving their employees the tools, so the education is still there that we've seen previously, but they're also giving their employees the permission and the space. So that's a big one, the space. Employees do not want to be overweight or have diabetes. Your employees do not want to be sedentary, but their work conditions have supported that type of lifestyle for so long. So we've really started seeing this culture assessment of how to give your employees the tools and the permission, but also the space. Leave them alone, let them take care of themselves. And then lastly, we really looked at how incentives, and starting to understand how incentives are really working and how they're not working, and how we can utilize incentives so employees feel that we're doing something for them versus doing something to them. Next slide, please. So our process at Shepherd of where we currently are, we're disrupting the status quo a little bit. We're not just doing it because every other company is doing it this way. And when I say doing it, we're doing wellness, right? We're not just doing certain things because other companies are doing it this way. And the reason is because Other companies may be doing it that way, but what's the outcome? Can they show success? Can they show savings? And so we're doing things a little bit differently. We're really getting in and we're assessing your program. So if your answer was, I don't know what my investment is, but I'd like to, that's what we're doing for you. We're helping you understand your investment and how your incentives may be working, or they may work if you're thinking about creating an incentivized program. We're also advising on best practices and accessing our data analytics platform to really start making strategy based on what is individualized for you. And so that's really important when you're thinking about population health, and we'll talk about that a little bit later. The famous speaker Simon Sinek always says, start with your why. And so we're taking that approach as well. Every company has a why of why they do what they do. And every company and business has a why of why they want to do well-being. So this company over here might be a recruitment strategy. This company over here could be wanting their employees to feel that they are cared for strategy. So there's lots of different reasons why your company would do well-being. And so we get in and kind of understand what's most important to you, and then start to align that with your overall culture strategy as well. So again, this alignment is taking place. We're not siloing wellness out here and coming up with our own ideas. We're kind of helping to start heal that wound versus just continuing to put band-aids over top of it. Next slide, please. So you may be thinking, Brittany, but what's the ROI, right? But what's the ROI? What's going to be my return on this investment? Is it even possible for wellness to provide an ROI? And I've never been a fixed mindset person on this idea. And so, but I will say, that sometimes we can't show an ROI, and that doesn't mean we shouldn't do it. It means that we should be very strategic with our investment. So again, knowing what our investment is, knowing that the potential to have a return on that investment is very unlikely, and then arming ourselves, our HR professionals, individuals working with certain vendors on the questions to ask, so that we're not falling into the trap of thinking we'll be getting a savings on this ROI. And if you still are like, that's fluffy, I don't want to do wellness because there's no return, that's fine. Think about the ROI of your mom. And I don't want to say a mother joke here. I'm not trying to do any mama jokes, but the investment your mom gave to you of teaching you the morals and values you have made you who you are today, right? And you may not be able to put a price tag on that, but you sure and heck probably are very thankful for the return that you're seeing right now. And so that's just a different way to think about the ROI. And I guess it really, you think about it of ROI, you think about the VOI, or the value on investment. So there's a lot of value that we can begin tracking, and we do that for a lot of clients. So this is how we can see if the strategies you put into place are successful. A lot of this comes from qualitative data. So do your employees know your why? Do they feel that they're supported? Do you know what barriers they have? What's in their way to being taken care, or to take care of themselves? And so that's just something to really think about, of how can we help you measure the value on your investment, so that we know a year after we do this program or these initiatives that they are successful, or if we need to pivot, right? And then the last piece here is, I call it roti because that's an Indian delicacy. It's like a flatbread, but dietitian joke. But the return on time invested, roti. Your time is precious, right? And some people even say time is money. And so we have to be very strategic with what we're doing, and not just come up with a million different ideas, or I call them what we're doing, because that still takes time. It still takes energy. So the more we really are focused on the time that we're investing, that being also part of this overall investment, the smarter and the better outcomes we're going to see. Comes from the famous Albert Einstein quote around insanity. The time is now to do something different when it comes to maybe altering your well-being strategy, enhancing it, or creating one that's very strategic. Next slide, please. So where is the industry going? The industry is going around focusing on the overall employee experience. If you don't get anything from this presentation, please get this one thing. Your culture, how your employees feel, their experience in your organization will trump anything you're doing from a wellness standpoint every time. So culture will trump wellness every time. So like I've talked about, we're starting to see this alignment, organizational goals, organizational strategy, mission, vision, shared values, having employees understand that, feel that they belong in that, then giving them, again, the permission and space to be able to take care of themselves. They know how to, they just need to have the barriers broken down to be able to do so. Understanding also cultures and then subcultures as well is important in that, and we can talk to you more about what that means. This whole idea, and you might start seeing this, designing work for well-being is also an important thing to think about where we're going. And you might have seen Google have ping pong tables or slides in their company, and I'm not saying you necessarily have to do that, but again, this comes down breaking down the barriers of what is in your culture and what's in your subcultures that's holding people back from really focusing and taking care of themselves, their whole self, including their physical health, but also that entire well-being part of their life. I think about how John in the manufacturing plant I worked at, how John could really have benefited from maybe his manager having some mental health training, whether that's empathy at work or psychological first aid, what his manager could have told him or what advice he could have given him during that time. Or if John knew he could have went to a specific employee or a specific area and talked to someone about some of the stuff he was going through, if he really would have focused on drinking in the evenings versus maybe taking care of himself or going on a walk in the evenings. Just from an internal standpoint, intrinsic motivational standpoint. So we're seeing a lot of, or we will see a lot of mental health embedment, the easeability of being able to get mental health support internally in the workplace, and training our specifically managers and leaders, anyone can be a leader, managers and leaders in the organization to feel confident and competent to be able to provide this psychological support and psychological safety in our companies. We'll see a lot more and that's around management, leadership, and investment. So just investing in your people more to really not put it all on HR, but putting it back in the teams and back in those subcultures. Perfect time for another poll. So the next poll is, do you know about your insurance carrier services or carrier resources related to well-being? So if you can answer this question, so your insurance carrier, if you provide insurance to your employees, what are they doing when it comes to providing resources available to you related to wellness or population health? So yes, I do, but we don't use them. Yes, I do know the services and we use them. I don't know the services and we're not interested, or I don't know the services that my carrier is providing, but I would like to. All right, we can get the answer to that. Sorry, we're kind of flying through. Hopefully everyone's paying attention and taking these polls. All right, so really close. Yes, I do, and we use them. So all of the individuals who are on the call that maybe don't know their resources, there's other people using your resources, so use it. No. And then yes, I do, but we don't use them. So there's a lot of potential there because you know how to do it. We need to help your employees know how to do it as well. And then third is no, we don't, but would like to. So the next slide, we're going to talk a little bit about where we see the population health area going in the future. And can you go to the next slide? Oh, I see a screen. That's okay. it's hard to flip like back and forth between the polls and the, yeah, perfect. All right, so, you know, where we're seeing population health evolve is really putting in things back onto the carrier. The carriers are providing well-being or wellness type program specific resources for your people. We just need to help them use them. Sometimes there's even incentives to attach to that, so it's no more money out of your pocket. So we need to help you understand that and help your employees understand those resources available. And it also helps kind of align a little bit more with your strategy. So in those carrier resources are kind of like carrier portals. So you can actually learn different things when it comes to in-network providers, quality care, what your deductible is if you've reached that. So those portals, those carrier portals are really important for your employees to overall understand and kind of learn so they can make those intrinsic decisions on their own that are smart. Also, where we're seeing population health go, and this can be a little dependent on group size. So I don't want any groups out there to think, you know, my company's too small, we don't get any type of claims or analytic data. We can still talk to you and begin the conversation around how we could potentially do some population health programs, knowing that we don't have a lot of data. But for those organizations in the medium to high range, we are only for doing population health programming based on claims and analytics that we're seeing. So the days of doing a walking challenge or doing a Biggest Loser challenge just because we've always done it, they're going to halt. They're going to come to an end. They're going to thankfully die, and we're going to start seeing some of these population health programs and population health vendors stepping forward and doing things knowing that there's a problem and this is going to be the solution. And the solution is going to be really interesting because a lot of times this is going to be driven by a vendor. So a vendor is going to say, I'm going to help drive down your musculoskeletal claims, or I'm going to help drive you down your diabetic claims. And we have to help you hold them accountable. That's what we didn't do in the past. We just had vendors make all these promises, be all flashy, and then there's no outcome, right? And so we're going to help those vendors hold them accountable. And one way to do this is through an organization. It's called the Validation Institute. I'm sure many of you have not heard of that, but the Validation Institute is actually a company, an independent company that validates the outcomes of these wellness or population health vendors. So they're validating that what they're saying they can do, they're going to do, and then there's a guarantee on top of that. So you're kind of like, you know, if they don't have the outcome that you set out to have, they'll give you your money back. That's what that guarantee is. So just something to think about before you invest more money into a wellness vendor. Definitely talk to us first, and we can check with the Validation Institute to see if there's any validation of their programming, what they're promising. And then if there's a guarantee on top of that. A lot of people don't know that that's out there. It's really important. And then lastly, where we've seen the industry continuing to evolve is around health literacy. So a lot of companies have these wellness programs tied to their premiums of you get a screening done or you get a physical with your doctor and you get money off your premium. And we're starting to like enhance those programs a little bit because we've seen some issues with that. And so one thing we'll start seeing is really arming our employees with what happens during those preventative visits, the questions to ask their providers, not just around their health, but also around, you know, what's being billed. And so kind of helping them be smart and confident consumers. You know, our healthcare system is kind of set up to be a sick care system. I don't know if you've heard that analogy, but we gotta, until the provider RVU structure is just shattered, we have to arm our people to be very confident in knowing that they can be their own advocate and what goes on the back end of healthcare, so that they're not pulled into that sick care. I think I heard a statistic where number one cause of death in the US is heart disease, number 2 is cancer, and number 3 is being being told you have too much going on medically, and so the healthcare system kind of kills you. And so that's just really something to be focused on, and make sure that our employees, again, have the education around health literacy to ask certain questions, know where quality of care is, and feel confident in those doctors' offices. The next slide is our last slide, and it's not necessarily where we've been for wellness, where we currently are, or where we're going. It's actually like what we're doing in next month. And so next month is Mental Health Month. Your employees are going to see this on social media, on Good Morning America, and I hope they see it from you, because you have the ability to really provide them with a lot of support. Roughly half of American workers say they feel comfortable talking about mental health in the workplace, which is kind of an interesting quote, that half do and half don't. So can we break down some of that stigma and make it feel more normal? Or can we talk to our employees that are ready to talk about some of this stuff? There's a lot of stuff going on in our world, and our people are going through a lot, especially post-pandemic, especially with a lot going on. Couple takeaways, easy things we could maybe do. Help your employees understand their impact. Helping your, not employees, helping your managers understand their impact. Your managers or leaders are where your employees are going to go to when they have a problem. Your managers and leaders have impact on your employees' mental health. Just help them understand that. The EAP number, so your company may have an employee assistance program. Help your employees understand that's counseling. It's not just an EAP, whatever those words mean. It's counseling, and here is the phone number. Not just an email of the benefit guide that has a full page. No, it's counseling. You get this many sessions, call this phone number. It's for you and your family. Make sure they understand that. Speaking of phone numbers, the EAP phone number and then the 988 crisis number are two phone numbers that hopefully all your employees have in their phone. That's an easy thing to do in May, to make sure they understand the counseling services they have available for them and their family, and the crisis number that they have in their phone, and maybe in any of their family members' phones as well. So that's the webinar. Hopefully you found value, and you kind of maybe made you think a little bit differently about wellness, physical health, the mechanistic thinking that we've done in the past, and how the simplified thinking really hasn't provided us with any cost savings, let alone much outcome. Where we currently are at Shepherd, and how we can help support you and start this conversation, and how it can be individualized to your culture, and then where we see the industry going and how we're going to be keeping up with that. We'll open it up now to questions I can answer.
Yes, thank you, Brittany. If you have any questions, you can ask those in the questions box in your panel. We will respond to as many questions as we can today, and if we're not able to, we will answer those in the follow-up email later this week. Brittany, it looks like we have our first question. The first question is it better to have biometric screenings or send employees to get their annual physical at their PCP?
Good question. Like I said during the webinar, a lot of companies are doing this, right? They're either doing a biometric screening, you know, to see, so employees know their numbers, if you will, or they're doing, you know, go get your physical, and then you get a premium reduction. I think this is a very much individualized case. So I'm not saying I hate giving great answers, but I have to here. I don't want to say there's one over the other is important. I think we need to take a step back to say, if we've done this over the past years, are we successful? What does success look like for us? Is it important to us? They say if you treasure it, measure it, right? And so do we treasure knowing people's biometrics, like the aggregate results we're seeing? Is it helping us move the needle? Do we treasure people going to their providers, and that's important to us? And how are we measuring that it's successful? Is it just participation based, or is it we think we'll have a cost savings and we want to track that, because we probably can't do that. It's a little complicated to track ROI from a screening physical. Actually, will probably increase your costs for your employees to go get a physical or a screening, because it's going to open the door to some other problems going on.
Thank you. We have another question that just came in. How do we know if our wellness program is working?
you work with us. No. So that's really what we're working with clients and understanding of this strategy, right? So aligning the well-being strategy with the organizational strategy, really fixing the wounds within your organization, your culture, to know if your work culture is really supporting well-being, and then setting specifically qualitative goals around what we think success will look like in a year, and make sure we hit those. And if we don't, it's okay not to hit a goal. We just pivot and try something new. So we have to set specific, strategic, maybe even wellness coach over here, SMART goals, to know that in the next year, you know, we know it was successful. And that's why I say work with us, because it does take time to kind of do all of that, and that's probably maybe why it's not done. And so working with us, we can help hold you accountable to some of these goals that you're wanting to do.
Thank you. And I think we have time for one more question. So I will pick one more question out. Brittany, do health insurance carriers consider whether or not a company offers a wellness program, or do they offer any discounts if you offer a wellness program?
Yeah, it's a good question. We hear that a lot. Just advising employees, maybe they've heard that from another carrier, you know, another company, maybe saying you need a wellness program because it, you know, will help lower your costs for insurance. And what I would say with that is, one, that's very unlikely. But two, if it's possible, or if someone's promising you that, ask them for specific examples. So ask them for specific examples of when another company has put in a wellness program, that program being successful or whatever, and then the insurance carrier coming back and saying your insurance is less because you have a wellness program. So ask for those specific examples. A lot of vendors, especially wellness vendors out there, are going to promise, again, these savings, these ROIs, productivity, increased health for your employees, and we're not holding them accountable to doing so. And so we just don't want you to fall into the trap of, you know, we helped this company save XYZ and per member per month kind of marketing strategies, without asking for specific examples, case studies to what happened and the specific savings around that.
Thank you, Brittany, and thank you to all of the people who have attended today.